Hello, welcome back. This is your second week of paramedic class. You've survived the first week. Congratulations. I'm sure you're still feeling overwhelmed, and I totally understand that. But as we go through class, things will all become easier, and you'll understand more and more every week. So this week we are going to talk about medications that we use to control seizures. Now, what is a seizure? A seizure is erratic, non organized neurons firing within the brain. And usually, seizures are self limiting in the fact that they last a few minutes and then they stop, but sometimes they don't. And we need to intervene in those situations and stop that seizing. But just because we have these fancy medications doesn't mean that we can forget about our basic airway adjuncts and our basic treatments. We know that if the patient is seizing and they have vomitus in their mouth or their airway isn't patent, we need to focus on that first. And then we can worry about controlling the seizure if we need to. The vast majority of patients that we see with seizure-like activity, the seizures have stopped prior to our arrival. There might be a subsequent seizure coming down the road, but a lot of times we see those seizures, we find the patients in a postictal state. So the medications that we carry on the ambulance for seizures are four medications. Three of those are benzodiazepines, and the fourth one is an electrolyte. So let's talk about the first one. The first medication we're going to talk about is Valium. Valium is also known as diazepam. Diazepam is the generic name for it, and Valium is the trade name. It is a benzodiazepine, like I said, and it is given for seizures. The dose for diazepam is 0.1 milligrams per kilogram given slowly. Now, this is probably the first time that we've talked about milligrams per kilogram. Now, what does that mean? That means that our medication dose is weight based. We're going to give 0.1 milligrams for every kilogram. Your question might be, how would I know how much the patient weighs if they're having a seizure? You might not know, but we need to be able to estimate what our patient weighs. Now, that's a skill that we can sharpen throughout paramedic class. What I suggest you do is every patient you encounter, no matter what type of patient it is, look at them, guess what you think they weigh, and come up with your best educated estimate, and then ask them how much do they weigh. And usually they'll know within 10 pounds or so, and they'll give it to you in pounds. Now you'll notice that our dosing is in the metric system. So we will need to convert that pounds into kilograms. And how we do that is we take whatever they weigh in pounds and divide it by 2.2. That gives us our weight in kilograms. For example, if we have someone who weighs 220 pounds, you divide that by 2.2 and you come up with 100 kilograms. If someone weighs 110 pounds, you divide that by 2 and you come up with 50 kilograms. But that is something we'll work on throughout class, so don't get too hung up on that right now. But like I said, the diazepam, the dosage is 0.1 milligrams per kilogram given slowly. The onset of the medication is 2 to 5 minutes, and that's why it's maybe not our first line medication for seizures because of the slower onset. The next medication we're going to talk about is Ativan. Ativan is also known as lorazepam. Lorazepam is the generic name, and Ativan is the trade name. Now, it is the same dose of 0.1 milligrams per kilogram, but it is diluted by equal parts of saline and given over 2 minutes. The medication is more potent and it's more likely to irritate the vein, so we will dilute it with equal parts saline. However you achieve that is fine, as long as we dilute it down and get it nice and diluted when we give it, and then we give it over 2 minutes. The action for the onset of this medication is 2 to 5 minutes again, but it is not the preferred medication for cessation of seizures because of the slower onset. The third medication we're going to talk about is Versed. Versed is also known as midazolam. Midazolam is the generic name. Versed is the trade name. Again, the dose for lorazepam is 0.1 milligrams per kilogram, and it is given for seizures as well, and that dose is IV. It can be given intramuscular, and then we would double the dose, so it would be 0.2 milligrams per kilogram with a total max dose of 4 milligrams. Some of the medications that we are going to encounter week to week are medications that are used for different things. So when we talk about these in the weeks, we will talk about that specific use for that medication. And why I bring that up is because of the next medication, mag sulfate. Mag sulfate is a medication that we give for several things. And in this lesson, we're going to talk about giving mag sulfate for seizures. Now, mag sulfate, unlike the others, is an electrolyte. It is not a benzodiazepine. Benzodiazepines can be reversed with a medication called Romazicon. Mag sulfate cannot. So let's talk about mag sulfate. Mag sulfate is a powerful vasodilator and a powerful bronchodilator. So what we would give mag sulfate for is for a patient who has a seizure due to eclampsia. If you remember back into your EMT class, remember that preeclampsia is hypertension in a patient that is pregnant. And the thing that takes it from preeclampsia to eclampsia is the onset of seizures. Now, when we see somebody having a seizure, a lot of the time the seizure has stopped prior to our arrival. Now, there's a misunderstanding amongst EMS providers that mag sulfate is going to stop your initial seizure. Now, that's not actually true. You might have to give a benzo, one of the previous medications, to stop the active seizure. The truth is, with mag sulfate, we give mag sulfate to stop the next seizure. We want to lower that blood pressure so they won't have that subsequent seizure. Now, why can't we give mag sulfate for that initial seizure? And the reason is it takes time to get it together. Usually the seizure will have self-regulated and stopped prior to giving the mag sulfate. We give mag sulfate in an IV drip. So we have to take the medication, we have to draw it out of the vial, we have to put it into an IV drip, mix it, and then administer it via IV. Now the dose for that is Some places will say 1 to 4 grams given over several minutes. It depends on which literature you look at. Some will say over 10 to 20 minutes, but the numbers we're going to use for class is 4 grams given over 3 minutes with a max dose of 30 to 40 grams, but we would never get that far into that amount of medication. We don't carry that amount on the ambulance. So the onset of the mag sulfate is immediate, and its duration, it lasts about 30 minutes. So please remember that mag sulfate is a powerful vasodilator and a powerful bronchodilator. We use it for bronchodilation in acute respiratory problems, specifically bronchospasms. We'll talk about that later when we talk about respiratory emergencies. But in this situation, the dose for mag sulfate for an eclamptic patient who's having seizures is 4 grams given over 3 minutes as an IV infusion. One of the things that you have to look for with magnesium is the loss of deep tendon reflexes. And what deep tendon reflexes are when you were in school and the doctor would hit your knee with his little hammer, that would cause your leg to kick. That's a deep tendon reflex. And if you lose those deep tendon reflexes, the patient has gotten too much mag sulfate.